And I welcome you both, gentlemen, and our attendees to this session. My name is Tom Fiegel. I have the privilege of serving as the CEO and co-founder of Beyond, and I'm coming to you from Mexico at our first facility here. So to kick this session off, may I please invite you both, Dr. Barsuglia and then Dr. Rasmussen, to spend a couple minutes introducing yourselves, please.
Sure. Yeah, can you hear me okay? Well, hi everybody, great to be with you. My name is Joseph Barsuglia. I'm a clinical psychologist by training and did a lot of my training in neuropsychology and then shifted into psychedelics about 8-9 years ago, working at a clinic in Mexico called Crossroads, where we were working with Ibogaine for addiction, as well as another psychedelic called 5-MeO-DMT, which has become more well-known recently, and worked in that capacity doing preparation, integration work, collecting data, publishing research, and then worked for a while with MAPS, the group that's doing the MDMA-assisted therapy for treating post-traumatic stress disorder, and was in the same training with Bruno for part of it, and yeah, now I do a lot of consulting, and my heart is just to build safe and sacred settings for the work. And I personally been really deeply touched by this medicine, which I was treated for Lyme disease and have done a number of Iboga treatments, and it was so impactful in my life. I studied in Gabon with the Bwiti and love the culture and the tradition where this medicine comes from. So I'm really happy to be here with you all, and this is near and dear to my heart.
Thank you for being here. Dr. Rasmussen.
Hey, good night. And first of all, thank you for the invitation. It's an honor and a pleasure for me to be here. Well, my name is Bruno. I am a medical doctor. I originally was an internal medicine specialist, but in 1994, I started to learn about Ibogaine and start to work with it. And it was very much more gratifying working with Ibogaine than the regular medicine practice. So it catched my life, the psychedelic medicine. But at that time, I didn't even know that psychedelic medicine existed. I was working, let's say, alone. But as the years went passing by, I started to meet and to know a lot of people in the Ibogaine movement, and started to be a part of the global movement on Ibogaine. And as Dr. Barsuglia mentioned, we were together in a training in MAPS in 2016, I think, and it opened my mind to other options in psychedelic medicine, not only Ibogaine, but MDMA and other substances too. So now I consider myself a real psychedelic doctor, but what I really work with and what I really know about is Ibogaine. Here in Brazil, we can do legal Ibogaine treatments. There are some regulations that allow us to do it legally. I don't have a clinic. I work in a public hospital where we can do Ibogaine treatments. And I'm here to try to collaborate if I am able to help to let you understand a little more of Ibogaine and to get interest in this beautiful medicine.
Thank you both very much for being here. Thank you for your introduction, Dr. Rasmussen and Dr. Barsuglia. So the way that we had intended for this session to go today was split it sort of half and half. The first session or section of this session will be led by Dr. Barsuglia to discuss specifically some of the details as you understand them based on your own experience and training and research on how Ibogaine works in the brain, specifically to treat substance use disorder. And then Dr. Rasmussen, from your perspective, will go at a similar set of questions, but from your medical perspective as well, based on your own research, experience and training and observations. So Dr. Barsuglia, I will invite you to take it away and help us understand this important topic.
Great, thank you, Tom. And yeah, I kind of enjoy making slideshows, and I'm a very visual person. So when you asked me to speak, I'm excited to kind of lay this out because it's a pretty complex topic, and we only know very little about what Ibogaine truly does in the brain. There's been a number of studies, and there's a budding literature base, but it's still in its inception in a way. There's much more research on a lot of the other classic psychedelics than there has been on Ibogaine. So I'm excited to share this, and what I'm working on now is more with veterans too. And so there's many applications for Ibogaine, and my background is a psychologist, so I'm going to speak what I know about the pharmacology and neuropsychology of this, and would defer to Bruno for more of the medical information. So we can dive in here. So I think it's always important to ground the topic in the indigenous historical roots of where Ibogaine comes from, and this is not something new. This has been used for potentially millennia in Africa, particularly by the Bwiti, which are span West Central Africa and in Gabon and Congo Basin. And it's been used as a sacrament, as a tool for healing, as something for initiating individuals into adulthood. And there's a whole rich tradition and ritual and ceremony that's, in my view, it's a technology. It's a ritual technology. It's a healing technology. And Iboga, the meaning of this word comes from a Tsogo language, which Iboga means to take care of in its essence. And when people do this medicine in Gabon in the traditional way, there's usually lots of ritual baths and purification and confessions. I went through an initiation. I had to confess everything I've ever done in my life into a bucket of water and then dump the water on my head, and so there's some of this things, might be the primal roots of within the 12 steps in Alcoholics Anonymous, confessing of defects of character and making amends. And there's this preparatory process. And it's considered a death and a rebirth ritual where initiates are oftentimes connecting with ancestors to get in touch with their true spiritual identity. And when you go through an Iboga initiation, you're considered what's called a bonzi, which means you're a baby. So it's like you're this reborn baby coming into a new life. And what I love about the Bwiti tradition is it's so collective that in the ceremony, which often goes for days, the whole point of the ceremony is to eat medicine and dance until you become one heart, like one resonant collective heart as a group. So this is kind of the backdrop of how it's been used, although the addiction applications are more recent. It's been used for millennia for healing the mind, the psyche, the soul, some might say. When we think about Ibogaine treating addiction, we have to define, what is a substance use disorder. These are buckets that are used in the DSM manual that kind of have these four facets of, in addiction, there's typically dependence, craving, tolerance or withdrawal to a substance. A person is impaired in their capacity to control their use. It's out of control. They're not able to stop it, even if they try. And there's social damage that usually happens due to hiding substance use or neglecting other domains of their life. And they're often involved in risky behaviors, like illegal behaviors or things that could jeopardize, say, their work or their marriage, your finances, etc. And when we think about addiction, a lot of addiction treatment is very much focused on the biological or the psychological, but it's many facets. There's societal aspects, there's economic aspects, even certain countries that have governmental policies have different rates of addiction, like, for example, like Portugal, who's decriminalized drugs. There's spiritual components, there's multi-generational aspects, and with Ibogaine, I think the opportunity is that it addresses the biological and the psychological, but can also address some of the spiritual, existential aspects, as well as in Buiti, they talk a lot about the generational patterns that Iboga can help heal or disrupt, and a lot of addiction we know is generational as well. So what's pretty amazing about Ibogaine is, in medicine, there's certain pharmaceutical therapies, there are opiate replacement drugs or tools used for alcohol cessation, and they're kind of substance specific. But what Ibogaine does is, this is a list of the 10 most commonly used drugs in the US. Ibogaine has demonstrated effects in essentially 6 out of the top 10 most commonly abused drugs, at least this is a list in the United States, such that it has anti-addictive properties to all these different substances that have pretty different mechanisms of action and psychopharmacology. And Ibogaine has this kind of broad spectrum anti-addictive effect, so it can be effective in all these different areas of common things that people get stuck using, in addition to things like even food addiction or sugar addiction. So when we talk about how Ibogaine works in the brain, this is sort of an old school evolutionary map of how brain evolution has happened. Starting with these more primal reptilian brain structures, coalescing to the neocortex. And a lot of addiction really lies in these more primal brain structures. So in the brainstem, this is this primal sense of am I safe in my body? In the limbic system, this is a lot about emotional processing, emotional memory. And so we're going to see what's pretty remarkable about Ibogaine is the actual structures in the brain that addiction tends to lie in or be present in the neurocircuitry. Ibogaine has an effect directly on these really deep kind of primal brain structures. So this is sort of a busy slide with a lot of content, but this is a kind of a map of what brain regions are involved in addiction. And what's happening in addiction is a person is typically getting hijacked, in your frontal lobes, which are kind of like the CEO or the manager of your brain. In this part of your brain, you might know, hey, my addiction is destroying my family, my bank account, my life, my job, but there's this compulsion, there's this kind of entrapment that's happening. In the trauma literature, people call it something like amygdala hijack, where you're getting hijacked by this kind of fight or flight centers in your brain. And in some ways, addiction is overlaps with those regions, but it's also deeper. So you have structures called the basal ganglia, which are involved in learning and reward processing. A lot of these regions are heavily dependent on dopamine, on the neurotransmitter dopamine, which is implicated in reward and desire. And so there's kind of this bottom-up phenomena that's happening with the basal ganglia, with structures called the nucleus accumbens, the thalamus, the thalamus is known kind of as a gatekeeper between some of these deeper brain structures and the higher kind of cortical structures of the brain, and then an area called the ventral tegmental area, which makes dopamine in the brain. And what happens is there's a cycle, in addiction. Someone uses to feel normal or to feel pleasure, and then there's a crash or a withdrawal, negative moods, depression, anxiety, and then there's a fixation on how do I get out of this suffering, and the cycle kind of perpetuates and leads to compulsive behavior. And really you're getting hijacked by the wires that are crossed at this deep level, this deep kind of primal level in the brain. And then eventually there's kind of a down regulation in dopamine, and people just need their opiates or the meth or cocaine just to feel normal, essentially, because of this pattern of suffering. So Ibogaine is pretty amazing in terms of its psychopharmacology. It's very complex. It works on a kind of almost every single neurotransmitter. There's more work to be done, but all the major neurotransmitters that are implicated in addiction, it tends to have some kind of effect on. And part of the magic of Ibogaine is its capacity to pretty rapidly interrupt opiate dependence. So it has an effect on opiate receptors that is not your kind of simple mechanism of action like an agonist or an antagonist. It has a pretty complex capacity to attenuate opioid receptors, which are heavily involved in addiction neurochemistry, and the opioid receptor system is involved in this pleasure reward reinforcing cycle that someone gets kind of reinforced perpetually to a particular substance, specifically opioids, but also other substances. It's working on NMDA, which NMDA is involved in learning and unlearning. Ketamine is a pretty common psychedelic that works in sort of a similar fashion. Ketamine is an NMDA antagonist, and there are some data that suggests that ketamine can be useful in treating opiate withdrawal. And so Ibogaine is working on that front. It's working on the dopamine, the serotonin systems. It's working on the nicotine, acetylcholine receptors. It's working on sigma receptors and something called substance P. And it's working on these receptors that have kind of a high density or a high prevalence in these deep primal structures like the basal ganglia, the ventral tegmental area, the nucleus accumbens. And so it's kind of I see it as kind of like a symphony of what it's doing. And a lot of these new Ibogaine molecules that are being developed, like these cogener molecules, a lot of them only do a part of this. They don't necessarily do all of it. And they're trying to mitigate some of the cardiac risk, but in my opinion, some of these newer next generation psychedelics are missing some of the meat of all that Ibogaine does. I call this like the magic sauce of Ibogaine is its capacity to upregulate something called glial-derived neurotropic factor. And neurotropic factors are these proteins in the brain that people call it miracle grow for the brain, because these are proteins that are able to help the brain regenerate itself to form new neurons, new synapses. And people attribute this property of Ibogaine boosting GDNF in some of its long-acting effects, such that when people do an Ibogaine treatment, they often have a reduction in cravings for their substance of choice for weeks, sometimes months, because there's something really fundamental happening in sort of a rewiring of the brain. And this GDNF has the capacity to repair and boost functioning in dopamine neurons, which are clearly implicated in addiction. And also this has been shown promise in Parkinson's disease, because Parkinson's disease actually hits some of the same overlaps to some of the same brain structures as addiction, namely being the substantia nigra. And I highlighted some of these structures again just to overlap. These are structures that are heavily implicated in addiction and also sites of action for the psychopharmacology of Ibogaine. And so this area, the ventral tegmental area, the nucleus accumbens, these are, if you do any addiction kind of neuroscience research, these are kind of the hot spots of where it's suspected that a lot of the learning and conditioning of addiction is happening. So there's something adaptive happening with Ibogaine and potentially with GDNF, where it's potentially uncrossing the wires and regenerating brain cells in these deep, what would be called like subcortical brain structures, or even in the brain stem. This is another image, the same slide but a different image. So this blue line are like, these are dopamine pathways in the brain that originate in the ventral tegmental area, the substantia nigra, the nucleus accumbens. And when there's healing happening here, where there's regeneration happening here, where there's unlearning or new learning happening, this then can diffuse or be integrated with the frontal lobes of the brain and higher kind of cortical areas. And you see this when people go through an Ibogaine treatment. Oftentimes they just feel really grounded and clear, and they can start to have some spaciousness from an impulse to use, or this conditioned reflex to go to their drug of choice and have a pause and have kind of a mindful spaciousness from being hijacked by this kind of more primal kind of cycle of suffering. This is a brain image of someone that we saw at Crossroads. This is a very old image this is from 2016. This was a veteran who we saw for alcohol abuse, who was scanned 2 days before Ibogaine and 5 days after Ibogaine. And what's notable that you would see is this is a SPECT scan. So this is looking at blood flow in the brain and metabolism in the brain. And what you'll see is the red and the white segments in the lower quadrant of the screen is there's this enhancement in blood flow in the cerebellum, which is sort of the more primal brain underneath the cortex, and this occipital lobe, which is in the back of the brain, as well as some of these deep brain structures are being highlighted in the white and the red. And I think this is the first brain scan that's been done that I've seen in the literature, and I'm sure there's going to be more done, but it's a bit novel in that sense. Scientifically, there's a confound because this person also used 5-MeO DMT, but this was scanned 5 days after Ibogaine, 3 days after 5-MeO DMT, and we suspect most of the action is because of the long-lasting effects of Ibogaine, which definitely outlasts 5-MeO DMT in the system. And what you see is an increase in blood flow in the cerebellum in the brain, and you see an increase in blood flow in the occipital lobe, which is the kind of the visual centers in the brain. And then at the bottom, you see an increase in blood flow in the basal ganglia in these two structures in particular, which are called the putamen and the caudate. So these are, again, structures in the basal ganglia, very deep structures in the brain, heavily associated with in the neuroscience of addiction, of what we know of addiction. So I just we're talking about how Ibogaine works in the brain, and what are the structures involved. And so I want to highlight the basal ganglia and this caudate and putamen. In addiction neuroscience, the basal ganglia is heavily implicated. There's a loading of dopaminergic effects, dopamine effects in these structures. The caudate being associated with reward pathways, motivation, risk analysis, so in the brain, discerning what is a risk or a threat, craving, substance craving, and then goal-directed behavior, which in addiction goes awry, or someone's goal is to, seeking out substances to alleviate their suffering, but it's actually, sabotaging their life. And then the putamen, which is also connected with reward, addiction. It's implicated in obsessive compulsive disorder. We could think about addiction as sort of a form of a compulsive disorder. And there's also a presence of glutamate and NMDA receptors present and implicated in this brain structure. And something pretty interesting is a friend of mine is a researcher in UFOs and what's called UAPs, unexplained aerial phenomena. And people that have claimed to have been exposed to UFOs have a hyperdensity in these two brain structures of the caudate and the putamen, a hyperdensity of neuron connection in these two brain structures. So you could take of that what you want. I think it's interesting and as a peripheral tangent and for consciousness, perhaps. The cerebellum, from this brain scan that we saw, it's the most active or largest shift that we saw was in the cerebellum with pre and post Ibogaine. And historically, people have thought of the cerebellum as something that was really just about movement or these kind of motor control, respiration, these kind of more primal human activities. But the more recent neuroscience suggests that some of the deepest kind of trace memories or Pavlovian sort of cue conditioning, drug memories might reside in the cerebellum. So this area has definitely evolved with movement, and we know when you're on Ibogaine, your movement is altered. People get ataxia, they have a hard time walking, they can feel dizzy, nauseous. So there's definitely a behavioral effect there. And in people that have been using alcohol chronically, there's often an atrophy of the cerebellum in this area. So at least in the case of alcohol, there might be some regenerative activities here. Some studies with Ibogaine at very high dosages have found toxicity in the cerebellum, but I think at clinically safe dosages, I think there's likely an adaptive effect. And this area is connected to the ventral tegmental area, which we know is a hot spot for addiction. So I think this is going to be an area of interest in the future for Ibogaine and how it's affecting the brain. This is a sort of a complex diagram, but just showing how the cerebellum connects up through the thalamus and then up to higher cortical areas in the brain. And these purple lines are white matter tracts that connect the deep structures in the brain up through the basal ganglia, and then kind of are some of the connective tissue to the cortex. And we know from our work with veterans, we suspect the GDNF, these neurotropic factors that regenerate dopamine neurons. A lot of these neuron tracts are dopaminergic. And so these are the same tracts that get damaged in traumatic brain injury, these like long fibers that connect different regions of the brain. So the same thing that's happening in addiction also will likely be helpful for many different forms of neurologic disorders. So there's something happening with the cerebellum, generally speaking, that if you heal these primal parts of the brain, there's some downstream effects that are translating to higher brain functioning to heal addiction and to help someone live in a different way. And just lastly, I shared a lot about how Ibogaine works in the brain. Ibogaine is a profound psychedelic that is unique amongst other psychedelics. It works much differently. A lot of classic hallucinogens work on the serotonin 2A pathway. We saw Ibogaine is highly diverse. This is a painting from a friend of mine, a Bwiti initiate, Ben Taylor, who tried to kind of capture the color saturation and some of the tracers and the visual effects that happen when you're on Ibogaine. This is a depiction of a Bwiti, I think a Ganga, a medicine person, that's a man that's dancing around the fire in the middle of an Ibogaine ceremony or an Iboga ceremony. This is just to conclude, this is sort of a long list of some of the mental effects, the psychological effects, the cognitive effects that show up in a journey. So when someone does an Ibogaine experience, like what shows up? It can be pretty unreliable as a psychedelic in the sense that oftentimes people don't have visions, sometimes people do. It's not, there's no stereotypical common Ibogaine experience, but there are certain facets that have shown up. And I made sort of this really extensive list here that was based on my observational work, and then there's been a number of researchers that have published phenomenological studies or qualitative studies on interviewing people. And what you tend to see frequently is a kind of people will see ancestors or faces that show up. Oftentimes there's an African motif of imagery from Africa or African landscapes or African faces. Interestingly, even in other countries and not in any Iboga ceremony and not with African music and not with Ibogaine that came from Africa, but just in the molecule itself, even in a hospital, there's this African sort of themes that can come through. People can see violent imagery oftentimes, which I think in some way may be kind of purging or defragging some of the more primal memories in the brain, of things that we don't want to look at or that are hard to face. It can be violence that's collective in nature, or it could be things that were personal to a person's life. Many people feel like they're traveling through the outer space, cosmic landscapes. It can show up like visions can show up kind of like a movie reel, or like have a sort of a cinematic quality to them. And Ibogaine can be deeply healing on an emotional level, sometimes during the medicine, oftentimes in the days afterwards, where people feel really connected to their body, and they're oftentimes they're being confronted with things that have been hard to look at, hard to feel. Ibogaine can kind of bring some of the defenses down around things that we tend to avoid. In addiction, people are oftentimes running from themselves, running from pain. And it can be very confronting, the things that show up regarding how someone may have neglected or hurt others in their life because of their addictive behaviors. Could be sexual trauma or relational abuse that surfaces, suppressed memories. It can be deep spiritual awakenings that happen. And then Ibogaine is pretty unique on a cognitive sense. When you're on Ibogaine or Iboga, the visions are really pronounced when you close your eyes. That's usually when you're taken into these more cinematic, visionary aspects. And when you open your eyes, you're usually able to orient to your surroundings. Sometimes people will see sort of like matrix overlaid patterns, or lights kind of skip around. People get tracers, but it's not like ayahuasca or like a high dose psilocybin where you aren't able to really orient to your environment. Typically, people can get up with assistance and walk to the bathroom. They in some sense, they usually know where they are. And then on the body side, on the physical side, there's usually a lot of detoxification. There can be vomiting, sweating, nausea. Ibogaine does have an effect on cardiac functioning, and oftentimes people will feel their heart beating more strongly, or they'll have an increased sensation of it. And then I wanted to share this really quickly, briefly. This is, I think, an interesting report from this veteran that we saw. I'll just kind of read the third paragraph. This veteran, again, was addicted to alcohol. He was coming in for alcohol treatment. And in his journey, he felt like he was transported into outer space and got to meet God and ask God questions. And he said he was transported to these different levels. And I'll just read this third paragraph. He began to see these symbols were showing up and giving him answers to his questions in a symbolic form. And for example, on one level of these levels he was at, he was visually taken to a scene of these pesky beings that were leeching or taking energy from his body, which he later interpreted as the spirit of the yeast in the alcohol that was holding on to him. And he reported in the session, when he became nauseous, that the pesky beings that were holding on to him were telling him not to vomit. But then when he started to vomit, the pesky beings were shouting no, and appeared to be leaving his body through the purging. And then he said he saw this cosmic matrix that had a column of light with spiritual beings that were going in and out of the light. And these pesky beings were telling him, don't go into the light. But then the creator of the matrix gave him these rocket boots and allowed him to merge with the light. And he felt like this is what essentially ended his alcohol addiction. He was purging the spiritual energy out of his body. So this is some of the kind of more bizarre and transcendent and cosmic kind of things that can happen in Ibogaine. So I kind of just wanted to leave you with that, to just to highlight the intelligence and how the depth of what's going on. So I'll end there and pass it back to you, Tom.
Thank you, Dr. Barsuglia. I'm aware my internet is a little unstable. Am I coming in okay, clearly? Okay, good. So wow, every time we do this, every couple of weeks, it dawns on me that we could have a much longer conversation. But what was most striking, in addition to the detail that you offered about the functioning of the brain and its relationship to psychedelics, and specifically Ibogaine, was that notion of that deep memory, that notion of the relationship to the experience of the substance use, and the visualization so rapidly, the shift in the relationship to the memory, deep memories that we're unaware of, as well as the relationship, the visualization or awareness of the presence of the substance use behavior, not just the substance itself. And so profoundly curious about that, and welcome the detailed and meticulous obvious meticulous work you did in putting together your slides. Thank you very much. Dr. Rasmussen, now to you. Can you tell us a little bit, just in your experience, your scientific research, is there more that you can add from a medical perspective to what Dr. Barsuglia was presenting on how, at a basic level, the Ibogaine is working?
Yes, yes, great presentation, Dr. Barsuglia. It was very comprehensive, very informative. There's nothing a lot left for me to talk about, yes, because you really talked about all the knowledge that we have until now, because there's a lot that until now we don't know yet. But it was very informative about what we really know nowadays about Ibogaine. So maybe what I will talk about could seem a little repetitive, but I'll try to make a brief commentary on what I usually see when I work with Ibogaine here in Brazil. Well, I think that what we always say that Ibogaine has two kind of effects: the neurochemical effect, as you mentioned, acting in a lot of receptors. It's the complication about Ibogaine, because there's not as so simple as other medicines that acts and reacts only with one or two receptors, but Ibogaine seems to react with a lot of receptors in the brain. And this explains, in my opinion, why it's so effective against different types of addiction, because you see in the United States, you use Ibogaine more for opioids addiction, and here in Brazil we use more for stimulants, mainly cocaine and crack cocaine addictions. But as you mentioned, we can see Ibogaine being used in eating disorders and in gambling disorders, sexual compulsions. So the reason of this is exactly that it acts in different receptors in the brain, and these different receptors are related, each one, to different kinds of behavior, of addiction behavior. So it's very complex, but what we can take from this is that Ibogaine working and reacting with these receptors, for example, the dopamine receptors and the serotonin transporter receptors, this helps the brain to get back their its balance, its neurotransmitter balance, and this puts the patient, the person who's taking Ibogaine, in a new state of balance in the brain, that he feels okay, he feels good, he feels happy, he feels motivated. And so this helps people to stay away from drugs. Before, the most of the times people are using drugs exactly to try to get back a lost balance, a lost mental balance, a lost emotional balance, let's say. And Ibogaine, after some hours, it brings back this balance, and probably acting in this many different receptors that gives again the balance that is lacking. There's another way of working of Ibogaine that you mentioned, the GDNF way, the gliocell derivated neurofactor. Ibogaine makes an augmentation of the GDNF in the brain. You can, the time of our life that we have more GDNF in the brain is the first year of our life, the first years, when we learn a lot. The first years of our life, we learn a lot. We learn around 80% of everything that we learn in our life. We learn in the first year or in the first 2 years, because we learn at that time things that nowadays we don't remember, that sometime we wasn't aware of these things, but we learn in the early childhood what's hungry, what's thirsty, what's comfort, what's the discomfort, the voice of the mom, the voice of the daddy, and a lot of things that we can even remember because we learned it so early in our lives that we think that we were born knowing this, but this learning happened in the early childhood, and this happens because we have a lot of GDNF at that moment of the life. And when you take Ibogaine, a few hours after taking it, we have more GDNF in our brain that a child of 1 year, even if you consider the difference of weight. Even if you calculate the difference of weight of a child of 10 kilograms, for example, to a normal adult of 90 or 100 kilograms, we have the adult on Ibogaine has a lot more GDNF in the brain than the child. So this makes, as you mentioned it, a lot of reconnections. This activates the neuronal plasticity. So the brain make new synapses, new connections between the neurons. And when you don't have this connection, GDNF helps to have a new connection. And when in the places that you already has that connection, but maybe it's not working properly, Ibogaine or the GDNF restores the connection and making so the brain work in a more optimized, let's say, way. So you can at this moment understand better some things that is happening in your life. You can have insights. You can deal more efficiently with your emotions. So this lasts 4 hours, and this the state, let's say, of consciousness expansion helps the therapy, the psychotherapy after taking Ibogaine, because an important thing to say is that Ibogaine is an enhancer of the psychotherapy. What will help the person will be the psychotherapy. What Ibogaine does is prepare the person for a good and efficient psychotherapy. For sure, medicine is interesting because each individual reacts differently from another, but normally we don't see a lot of benefits in a person taking Ibogaine and doing nothing after that. We see the more benefits in people that take Ibogaine, and after that they do the therapy. Differently from MDMA, for example, when you take MDMA and you want to talk, and the MDMA assisted psychotherapy is made during the effect of the drug itself. Normally on Ibogaine, people don't want to talk a lot. It's difficult to talk because you are dizzy and you have nausea and you have ataxia and you have even difficulty to move your mouth. So normally the psychotherapy works better being done a few hours or even a few days after the Ibogaine session. But it's the same concept. The psychotherapy is the main intervention, and Ibogaine, as MDMA is and as psilocybin is, they are enhancers, they are helpers to the psychotherapeutic process. So this fluid, let's say, of GDNF makes the brain work in a more efficient way, and people are more able to reach some levels of consciousness that in ordinary states they are not so able to do that. And then we enter in another way that Ibogaine works in the brain. There is exactly the psychedelic experience or the consciousness expansion that I mentioned. This situation, it does not happen to everybody, but to the most of the patients. But it's interesting that some patients, they are experiencing the psychedelic effect on Ibogaine, but they are not noticing it. We that are outside of the experience, we that are used to to deal with this kind of patients, we can see that he is having an experience, but at that moment, he cannot perceive that. He's not aware of that. Most of the patients are, when they arrive to the treatment, they are too much focused on this experience, and they arrive saying things like, I'm going to take Ibogaine because I want to see my daddy that died. I want to see something that traumatic that happened in my life. I want to see it better. And when you want to see something on Ibogaine, normally Ibogaine doesn't show this for you, because as the Biwiti say, Ibogaine doesn't give you what you want. It gives you what you need to experience, to know, to see. So it's very interesting, because people arrive here waiting and wanting for an experience, and they has the total opposite experience. And in the first moment, they are very sad and very angry about that. But after some hours or some days, they begin to understand that they really received what they needed and not exactly what they wanted. And this is a very important discussion, because now with this boom of the psychedelic industry, a lot of enterprises is being sold for millions and trying to patent natural compounds. And there's a trend to discover new molecules, to produce new molecules without the psychoactive effect, because this for sure will turn a lot easier to approve Ibogaine in the biggest countries and the major countries, like United States, for example, where it's Schedule 1. So a substance that could be used for the same function, for the trying to reach the same results, but without the psychoactive effect, would be a lot easier to be registered and approved by the FDA. But personally, I disagree with this vision, because I think that the psycho-spiritual, let's say, experience, or the psychedelic experience, is key to all the results. It's very important. And as I mentioned it before, even patients that are not aware of the experience, they are having the experience at some level, but for some reason, the brain or the inner healer decided that it was not so good for that person to really be aware of the experience. So it's happening in the background, let's say. But after some days and continuing with the therapy, this contents, this information, they arise and they appear in the conscious mind, and they can be worked with the therapist. So it's beneficial the same way. I'm not sure if using substances with no psychoactive effects at all, I'm not sure if it will have the same effect. We need to research, we need to try, but these substances, they are not even available at this moment to research, but they will be in the near future, I think. Let's do research. But from my experience, I don't believe that they will be so effective as the original substances, the natural substances, or even if they are produced, they are synthetic, but with the psychoactive effect. So I think that the psychedelic experience is very important for the results of Ibogaine, and it's very difficult to explain it. Probably it's exactly the sum of all the reactions with the receptors that we described, all the let's say alterations in the quantities, in the amounts of the neurotransmitters, and the rise of the GDNF. I think that everything is contributes to this, let's say, to the trip, the Ibogaine trip, or the psychedelic effect. It's important to say about the cerebellum effects. in the beginning, everybody thought that the cerebellum effects were only collateral effects and they were not important for the results. But now we know that the cerebellum effects are important and they are related to learning, as Dr. Barsuglia very well explained it to us. Another thing that's important about the effects of ibogaine in the brain is the substantia nigra. It's related to addiction, but it's related to Parkinson's disease too. And we know that ibogaine works for Parkinson's disease too. And in Parkinson's disease, what you have is an important drop in the dopamine in the region of the substantia nigra. So probably ibogaine arriving there and reconnecting the neurons and reacting to the receptors, probably it rises the level of dopamine and people show improvement in some symptoms of the Parkinson's disease. It needs more research too, but it's an effect that we that work with addiction, we don't remember every time, but the effect of ibogaine on Parkinson's disease is very important. And it's the same thing on depression too, because we know that in the depressive patients, we have drops in some neurotransmitters. And after ibogaine, you gain this balance again. You are balanced as you were probably when you were born. And for some reasons that must be studied, but some traumas or some things that can happen in your life, or even things like your food habits or the environment of your life, things that are related to depression. Ibogaine reacting with all these receptors gives a new balance to the brain, and it alleviates a lot depression symptoms. It's interesting because it works with microdoses, daily microdoses of ibogaine, and works with the the big fluid dose too. So we need more research to decide which would be the best approach for this kind of patient, because the fluid dose is more practical for the patient, because he goes to the hospital and takes ibogaine once and everything's okay in the day after or in the other day. The microdoses regimen is a little more longer, because you need to take very small amounts of ibogaine each day for 2 months or 3 months, but it's less risky, it's cheaper, it's less complicated. So more research is needed for us to understand the best approach that would be with depression. But it's important to remember this information, that really that ibogaine really restores the balance of the neurotransmitters in the brain, and this helps with addiction, this helps with depression, and this helps with Parkinson's disease. I would like to talk about the heart effects of ibogaine. I think that we are talking about the brain effects, but it's important because a lot of people are afraid of ibogaine, because ibogaine makes the heart work differently and people die on ibogaine. So it's important to know that ibogaine really affects the heartbeat. It can produce arrhythmias, a special type of arrhythmia, which is called the Torsades de Pons arrhythmia. The arrhythmia begins with the bradycardia. Normally the normal heart rate starts to drop, and it drops to a very low level, and suddenly it starts to arise and to beat a lot of times each minute. And after that, it's like the heart loses control of its own beats, so it starts to beat a lot of times per minute, but not more efficiently. So the heart beats very quickly, but not really pumping the blood. So this is the reason of some deaths that we see on ibogaine. But this happens in patients that are with predisponent conditions. They normal people that are really healthy and with no other substances circulating in the body, they are they have a very low chance of having complications. People that have complications on Ibogaine is people that are doing, in my experience here in Brazil, and it's important to say that the most of the experience that we have here is with stimulants treatment. Now we don't have a lot of experience with opioids treatment because in Brazil we don't have a lot of opioids addiction because opioids are very expensive for the average Brazilian people. So we see complications in people that are not in conditions of doing Ibogaine at that moment. They are forcing the Ibogaine provider to do Ibogaine. I want to do Ibogaine tomorrow. I need Ibogaine tomorrow. And it's not the right way to do it. The most interesting way to deal with it is to compensate the patient, do some blood tests, and understand what's happening and correct some problems, mainly electrolytes balance like potassium, sodium, magnesium. Be sure that everything is okay in the body, that you don't have other or a lot or at least a lot of other medicines circulating, a lot of antidepressants circulating, a lot of mood stabilizers circulating. It's important to go very slowly and taking off the medicines that you can take off, the medicines that you can taper off slowly for the patient not to suffer. But it's important to do the treatments in a slow way. We say here in Brazil, the slow medicine, to really give some time to the body, to the organism, to the system of the people, to regain the more close to the normal situation before taking Ibogaine. This prevents complications. This prevents deaths. Here since 1994, I've seen more than 2,000 treatments. We never have had a complication, and you never have had a death. The most important complication that we saw here was a patient that really vomited a lot. He vomited more than 30 times during the day. I don't know exactly why. But this guy, he showed with he showed after vomiting a lot of times, he showed some blood in the vomiting. He has an esophagus disease, let's say, and vomiting so many times in a short amount of time made this esophagus start to bleed. We did nothing about that. We waited and we hydrated him and gave some medicine to stop the vomiting, which we don't do normally. We did that because this was a special situation. Normally we let the patient deal with the vomiting because it's important. It's a kind of purification. It's really a purification, like Dr. Barsuglia mentioned it. But this guy, we gave a medicine to stop the vomiting, and the other day he was at home very, very fine. So if you prepare the patient well, if you take some measures to be sure that everything is okay in his body, in his system, Ibogaine is safe. You can use it since you are in a place that you have some medical devices and some medical advice to help with the patient, and everything will work fine. The most important thing is to know that each patient reacts differently from another, and it's not interesting to start with a big dose of Ibogaine to see what happens. The most intelligent way is start with low doses and go escalating the doses during the day until reaching an optimal momentum, an optimal situation where the patient is having the sensations, the results, the feelings that we want him to have without risking his life. Just to finish, I would like to comment that although Ibogaine has all these effects in the brain, some people take Ibogaine and nothing happens. They feel nothing. And it's a small number of people, but we can feel that these people are really don't having a background experience. As I mentioned before, they are not having the experience. But even in these situations, I saw these people, the most of them going better after being discharged from the hospital and having improvements in their lives than the opposite, that seeing a person that happens nothing and is not has no benefits from Ibogaine. I never saw a person having no benefits of Ibogaine. The most of the people has a lot of benefits, and a small amount has small benefits, but some benefits. So I think that it's my speech is that, and I'm at your disposal to answer any questions that you have.
Thank you. Thank you, Dr. Rasmussen. What a wonderful compliment to Dr. Barsuglia's presentation as well. I'll admit that I wasn't quite sure how we were going to complement the depth and breadth of Dr. Barsuglia's, but you did it perfectly. You really told a wonderful perspective from a treatment perspective, from a practitioner's perspective on the many benefits and experiences that you've observed and researched, and truly appreciate that. And at Beyond, you know, some of the things that you said fit right into our delivery model. We call it insight-oriented Ibogaine for a reason. And those insights are not always and usually not expected. I like that you said the Ibogaine shows you what you need to see rather than what you want to see. It's not a tour of what you would wish for. It's a real medicine. And of course, you know, the significance of the medical safety, of the rigorous evaluation, the technology, the training, both in addiction medicine as well as the emergency medicine, that we find so important is complementary to specifically what you were underscoring. So truly appreciate you bringing that up as well. But I love the grounded perspective that you bring to the conversation at the end there, that some people may not see a lot, they may not feel a lot, but there are still benefits happening. We had some interesting questions, and I know we're already over time, but maybe we could just take one or two, if that's okay with you. One interesting one, and I'll let either or both of you address it, is are there any contraindications for treating entheogenic medicines, treating with entheogenic medicines, cases of bipolar or certain meds or foods? What are we looking out for that could contraindication? And
well, at this moment, what we know about treating a bipolar patient is that the patient has a chance, a little more chance to have a maniac outbreak after Ibogaine, but it's not a big maniac outbreak, but what we call hypomania or hypomania. I don't know exactly in English how to pronounce it, but it's a small mania. And if you know that, you know the patient is bipolar and you know that he can go this way, you can stay a little more close to the patient in the days after Ibogaine that you normally stay. And if you see that he's entering this maniac state, you can give the normal mood stabilizer that he used to take to control this. And so the bipolar patient, normally he benefits from Ibogaine too. Other mental disorders like schizophrenia, for example, at this moment, the thinking of the people is that you it's not okay, it's not beneficial to the patient with schizophrenia, for example, to take Ibogaine. But I think that this will change in the future, because now we know that the psychotic outbreak is beneficial for the patient. It's a difficult moment, but after it goes away, it's beneficial for the patient. So I think that in the future, schizophrenia and other psychotic situations will not be a total contraindication for taking Ibogaine. In some situations, it will be done, because even these patients, they can benefit if it's done in the proper way.
Yeah, I would echo what Bruno said. I think people that are on the psychotic spectrum, because Ibogaine, it does push dopamine temporarily for a window, there's a vulnerability to people becoming manic. There's even a couple case reports in the literature of people that have had like refractory brief manic episodes afterwards. And some of it can be because of, oftentimes people have a hard time sleeping for a night or two. So if people are sensitive to sleep deprivation, that can catalyze some of that phenomena. But doing it in an inpatient setting or having some supervision, having some assistance with sleep, if someone's not sleeping for several nights, it can help mitigate some of that. Most mental health conditions, though, I think there's documented research evidence and definitely anecdotal evidence that Ibogaine can help with many different forms of psychological suffering. So you don't have to be hyper rigid in ruling things out. I mean, things like OCD, depression, anxiety, post-traumatic stress, prolonged grief, behavioral disorders. There's many different forms of, the most common forms of psychological disorders or presentations. Most of them can potentially be helped by Ibogaine. You know, I defer to Bruno on the medical side, but there's some medical things, you know, if people have certain gastrointestinal disorders or cardiac problems, they could be a risk, or have severe seizures, you know, have had strokes, or there's a whole kind of like list of medical exclusion criteria that's been established, you know, through GITA, which Bruno is involved with. So there's sort of a checkbox of safety parameters on that side. And then, yeah, certain substances, you know, Ibogaine can mitigate people that are actively, you can actively use opiates. You can be shooting heroin in some ways, like right until you get up to an Ibogaine treatment. But for certain things like amphetamines or alcohol, you do oftentimes need a window of sobriety. So sometimes people need to be like detox from alcohol, because Ibogaine can help with alcohol cravings and help correct the neurochemistry with alcohol, but it's not going to get someone through an alcohol detox, as it's more like on the side of GABA and other neurotransmitter pathways that Ibogaine does not particularly work on. So it's kind of substance specific with kind of the triage or the route that you would take with someone with preparing for an Ibogaine experience.
Thank you. Thank you. And please, both of you and our attendees, forgive me for turning my video on and off, but I've been trying to listen better than watch. And I've heard everything you've said when I turned it off, but I apologize for having to do that. Appreciate the question regarding support and stewardship for the indigenous leaders and communities that are stewarding the cultivation of Iboga that yields the opportunity to do this work. And we at Beyond are a significant supporter and advocate for other support for Blessings of the Forest and the work that they do in West Africa. in the moment or two that we have left, I would just invite both of you to just talk briefly about the research that you hope to do or hope will be done in the future related to Ibogaine assisted therapy for addiction, depression, anxiety, trauma. What do you hope to see after all of your experience and all of your work next that will benefit our understanding of the use of Ibogaine for this purpose?
Please, Dr. Joseph.
Sure.
Please.
Yeah, I'd like to see, there was this famous Chilean psychiatrist, Claudio Naranjo, that he was doing psycholytic work with Ibogaine, meaning like lower dose Ibogaine administrations coupled with talk therapy. And like Bruno mentioned, when you're doing a flood dose of Iboga, it's even hard to sling a sentence together. It's hard to talk. But at low dosages, there seems to be, what you see in the brain of these deeper structures being active. I think, in the old school kind of Freudian sense, I think some of these, the id or the subconscious or some of the deeper reservoirs of psychological suffering actually literally map onto these parts of the brain that are subcortical and are more primitive. And when you take Ibogaine, it kind of, in a way, it kind of flips your brain inside out in terms of its processing. It kind of, everything starts going bottom up. And so you have access to see things from a different vantage point. And you get that in the days after Ibogaine, but I think there's a place for like Ibogaine assisted therapy at lower dosages. So I think kind of resurrecting some of that, maybe based on Claudio's work and how other people have worked with it, say like at a half or a quarter of what would be like a flood dose. It makes for a long day, but I think there's something really intelligent about what Ibogaine does to the brain and people's capacity to see things from another lens. I think, I honestly think with the COVID epidemic, there's going to be a ton of people that have like viral-related neurologic issues, and neurodegenerative disease are of course like epidemic. As we live longer, we know how to take care of our vascular health. I think people's bodies might outlive their cognitive functioning of their brain. And so I think there needs to be more research on Ibogaine for neurodegenerative diseases. And it's, to me, I totally resonate with what Dr. Rasmussen is saying, that there's all these companies that are working on these new Ibogaine molecules, and to bring a new drug from the bench all the way to the market, it's it's like $100 million, and we don't necessarily need new molecules. We need clinical delivery of molecules that we already have that we know work. And I think Ibogaine could have so many other applications that could be explored, and a lot of that development is to develop patents, and some of it's for a good reason, to try to mitigate cardiac risk or things like this. But I think it's kind of ludicrous to try to extrapolate the psychedelic effects. Like anyone who's ever worked with Ibogaine and in the history of practitioners would say that's like in some ways like the dumbest idea to pull out the consciousness effects, the psychedelic effects, the intelligence that comes through, to like strip that out of the equation is in my opinion, is kind of preposterous. It's kind of a joke. But I think, looking at these different medical applications, just with Ibogaine, it's fine as it is, and it's in low doses at a microdose level. It's even more safe than at these higher flood doses. So I think there's any kind of neurologic disease like ADHD. There's so many, autism. In autism, it's a syndrome of disconnection between different brain regions, and Ibogaine could potentially have a promise for that. That would be my view.
Thank you, Dr. Rasmussen. In the last few minutes that we have, anything to add to that?
Yes. Well, I think what we are doing here in Brazil, we are trying to totally legalize Ibogaine here. As I mentioned, we can do legal treatments here, but it's difficult to import it because there's a lot of regulations to do the importation. So we need to import it dose by dose, patient by patient. This makes the treatment expensive and not accessible to the most of the people. So we are trying to fully legalize it here. And to do this, we have the orientation of the Anvisa. Anvisa is our FDA, and they said to us that they recognize the importance of Ibogaine because Brazil has a very huge problem with crack cocaine addiction. So we are going to a phase 2/3 research on Ibogaine, but we have not a lot of curiosity to see how will be the outcomes, because we know that Ibogaine works very well for depression, for addiction, for depression too, but I'm talking about addiction. But we want to prove that Ibogaine is safe, mainly related to cardiac problems. It's safe to be used if you use it in a proper environment with a good preparation. It's safe from the psychological point of view if you prepare psychologically the patient for that. So we want to prove this, the safety of Ibogaine for Anvisa to recognize it totally officially as a medicine. And I would like to see a research on depression and on addiction to answer the question, which more effective, fluid dose or microdose? Because as I mentioned it before, Dr. Barsuglia mentioned it before too, microdose is cheaper, is easier, it's safer probably, but the fluid dose is quicker, is impressive, the results in the day after, or even in the day. If you go give Ibogaine to the person at 8 in the morning, 4 in the evening, he is changing his speech, he is talking about new plans. It's very gratifying to see it. It's really beautiful to see, and when the patient reacts properly to Ibogaine. So I would like to have this doubt. I have this doubt. What would work better, the microdose or the fluid dose? And for addiction and for depression, the main objectives of this is to have to assure easier access of Ibogaine from the most of the people that need it, and the most simple that we can turn the process, the more cheap or the cheaper that we can turn the process, will help more people. This is what I would like to see in the near future about Ibogaine.
We totally at Beyond totally agree. I mean, I saw someone sent me today a graphic from a television program that showed 107,000 overdose deaths in 2021 in the United States alone. And it seems very clear that this and other innovations, this innovation safely applied with the psychological therapy, with the right preparation and agenda, and most importantly, aftercare. The acute and long-term aftercare is a much needed innovation for many reasons, not just the additional innovation that you've described so well. Well, we are way over time, and I'm deeply grateful to both of you, Dr. Barsuglia, Dr. Rasmussen, for taking the time out of your day, in your case, Dr. Barsuglia, and your evening, Dr. Rasmussen, for being with us and sharing this set of insights based on your experience, your research, your training, and your own observations related to Ibogaine. I also want to acknowledge and thank our attendees for participating, acknowledge Dr. Jeffrey Camlett, our Chief Medical Officer, for participating, this time as an attendee, but being here to support us in this conversation. Dr. Rod Paulson, I saw our Chief of Nursing, Vianney Perez, our Head of Psychology, Adriana Figueroa, and a key research partner and advisor, Dr. Thomas Kingsley Brown. Thank you all for being with us here at Ibogaine Insights from Beyond. And in our next session, we'll be looking at how can Ibogaine assisted therapy really change our underlying thinking about addiction. And we will be grateful to have Andrew Tartowski and others with us. So with that, I'll leave it. Thank you both very much, both Dr. Joseph Barsuglia, Dr. Rasmussen, our attendees, and team members for joining us this evening. Thank you all and good night.
Thank you so much.
Thank you. Thank you very
It's
much.
a pleasure
Good
being
night.
with you all.
Yes,
Thank
for me too. Bye-bye. Thank you.
you.
Bye-bye.